Okay, so, wow, listeners have sent in a lot on intestinal obstruction.
Yeah.
Really interesting stuff.
Yeah, definitely a topic people want to know more about.
And when you think about it, it makes sense. I mean, everyone's experienced some kind of digestive issue at some point,
Right. And when things aren't moving the way they should, it can be really concerning.
for sure. So today, we really want to dig into what happens when, there's a blockage, when that normal flow through the intestines is interrupted.
Right. So your sources mentioned two main types of intestinal obstruction. There's mechanical obstruction, which is a physical blockage.
Like a clogged pipe or
Yeah,
something.
exactly. Something physically blocking the passage. And then there's functional obstruction,
Yeah.
which is more about a temporary issue with the way the muscles in the intestines are contracting.
So they're not, like, moving things along the way they should be.
Right. But for our deep dive today, we're going to focus on mechanical obstruction, the physical blockages.
Okay, and these blockages can happen in different spots, right?
Absolutely. They can occur in the small intestine, which is sometimes called OID,
OAD, got it.
or in the large intestine, which is OIG,
OIG, okay.
and even in the gastric outlet, which is basically the area where the stomach empties into the small intestine.
So that first part,
Right. And these blockages can be partial or complete too.
meaning like some stuff can get through or nothing at all.
Exactly.
Yeah.
And understanding these different locations and types of blockages is really key to understanding the causes and the symptoms.
So let's talk about causes. What are some things that can lead to a mechanical obstruction?
Well, there are a lot of different things, and your sources break them down really well, sort of by where the problem originates. So we'll start with what are called extrinsic causes, which means the problem's coming from outside the intestine itself.
Okay, so pressure from the outside.
Exactly. And one of the most common extrinsic causes, especially for small bowel obstructions in adults, is post-surgical adhesions.
Adhesions, that sounds familiar.
Adhesions are basically bands of scar tissue that can form after any kind of abdominal surgery.
Oh, so even if the surgery was years ago.
Yes, exactly. These adhesions can actually cause problems years later. They can kind of wrap around the intestines and cause a kink or a blockage.
Wow, so something to keep in mind.
Definitely. Now, another big one for small bowel obstruction that your sources mentioned is incarcerated or strangulated hernias.
Hernias, right. That's where part of the intestine pokes through a weak spot in the abdominal wall.
Precisely. And there are different types, like inguinal hernias, umbilical hernias, femoral hernias, incisional hernias. Basically, if part of the intestine gets trapped in the hernia, it can lead to a blockage.
And that can be really dangerous.
Oh, absolutely. If the blood supply to that trapped portion of the intestine gets cut off, it can become a surgical emergency.
Okay, what other extrinsic causes are there?
Well, there's also volvulus, which is a twisting of the intestine.
Oh, like a garden hose getting kinked?
Yeah, exactly. And it most often happens in the sigmoid colon and the cecum, which are parts of the large intestine.
So those are like more towards the end of the digestive tract.
Right. And then there are also things like intra-abdominal masses.
Masses.
Yeah, things like enlarged lymph nodes, abscesses, or cysts, which are basically sacs of fluid. These can all press on the bowel from the outside and create a blockage.
So that covers the pressure from outside. What about problems within the intestinal wall itself?
Right. So those are called intrinsic causes.
Intrinsic, okay.
And here, tumors are a major concern. So colorectal cancer is the most common cause of large bowel obstruction.
Okay, so that's a big one to be aware of.
Definitely. But lymphoma and small bowel tumors can also be culprits.
And these tumors, are they growing inside the intestinal wall, like within the wall itself?
Sometimes, yes, they can grow within the wall and narrow the passageway, or they can grow outward from the wall and press on the intestine.
Got it.
And then there's stenosis, which is just a general term for a narrowing of the intestinal passage.
So stenosis itself isn't the cause, but it's like a result of something else.
Exactly. And there are a bunch of different things that can cause stenosis. There's inflammatory stenosis, which can be caused by conditions like Crohn's disease or diverticulitis, where chronic inflammation leads to scarring and narrowing.
Oh, so those long-term inflammatory conditions can actually change the structure of the intestine.
Exactly. And it can also be caused by radiation treatment, which can also lead to scarring.
Makes sense.
And then there's also complicated diverticulitis, which is when diverticulitis leads to stenosis or an abscess.
So it's like diverticulitis plus something else.
Right. And then there's intussusception, which is kind of a unique one.
I've heard of that. It's where one part of the intestine slides into another.
Exactly.
Like
a
it-
telescope.
Yeah, I remember seeing a diagram of that. It's pretty wild.
It is, and it's more common in kids, but in adults it can be triggered by things like polyps or tumors.
So polyps or tumors kind of pull part of the intestine in.
Yeah, that's a good way to think about it.
So that covers extrinsic and intrinsic causes. What's the last category?
The last category is intraluminal causes, which means the blockage is coming from something inside the intestine itself.
Okay, so something's gotten stuck in the tube.
Exactly. One classic example is gallstone ileus, where a large gallstone gets lodged in the intestine, usually in the ileum, which is the last part of the small intestine.
So a gallstone that's formed in the gallbladder
Yeah.
somehow makes its way into the intestine.
Yeah, it can happen. And it's usually a pretty big gallstone.
I bet.
And then there are swallowed foreign bodies, which is pretty
Just
self-explanatory.
swallowing toys, things like that.
Well, kids, but adults too. Sometimes people accidentally swallow things, or sometimes it's intentional.
Right, like people who have pica or something.
Exactly. And then there are bezoars, which are basically masses of indigestible material that can form in the stomach or intestines.
Bezoars, that's a new one.
There are different types, like phytobezoars, which are made up of plant fibers.
So like from not chewing your food well enough?
Yeah, that could contribute, but it's usually more complicated than that. Like sometimes people with certain medical conditions are more prone to forming bezoars. And then there are trichobezoars, which are made up of hair.
Hair. How does that even happen?
It's usually seen in people who have a condition called trichotillomania, where they compulsively pull out their hair and sometimes eat it.
Oh, wow. I didn't know that.
Yeah, it's pretty fascinating, actually. And then last but not least, there's severe fecal impaction.
So just like extreme constipation.
Right, when the stool becomes so hard and dry that it can't move through the intestines.
Okay, so we've covered a lot of ground here. Extrinsic, intrinsic, and intraluminal causes.
We have. It's amazing how many different things can lead to a blockage.
And you mentioned earlier that the location of the blockage matters. What's the difference between, say, a small bowel obstruction and a large bowel obstruction in terms of causes?
Yeah, good point. So in adults, small bowel obstruction is more commonly caused by things like adhesions, hernias, and tumors, like we talked about. Whereas large bowel obstruction is more likely to be caused by things like colorectal cancer, volvulus, and complications of diverticulitis.
Got it. So the underlying causes tend to be different depending on the location.
Right, and that's why it's so important to get a good medical history and do a thorough physical exam to figure out what's most likely going on.
Okay, so let's say someone has a blockage, a mechanical obstruction. What actually happens in their body? I mean, it's more than just things getting backed up, right?
Right, it actually sets off a whole chain reaction.
The domino effect?
Exactly.
Mm-hmm.
So first you get a buildup of gas and fluids before the blockage.
So it's like a traffic jam?
Yeah, I like that analogy.
Mm-hmm.
And this buildup causes the intestine to swell or distend.
Which probably isn't comfortable.
Not at all.
Yeah.
And this increased pressure inside the intestine leads to a whole cascade of problems.
Like what?
Well, first, the pressure can cause fluid and electrolytes to leak out of the intestine and into the surrounding tissues.
So they're losing fluids.
Exactly. It's called third spacing, and it can lead to dehydration.
And dehydration can be really serious.
It can, especially in people who are already sick or have other medical problems.
Right.
And then there's vomiting, which is another common symptom of obstruction.
And that just makes the dehydration worse.
It does, and it can also lead to electrolyte imbalances, like low potassium.
Especially with higher obstructions, right?
Right, because with higher obstructions, more of the small intestine is involved, and that's where most of the absorption of fluids and electrolytes happens.
So even though someone might look bloated, their circulating blood volume is actually decreasing rapidly.
Exactly. It's a really important point. They're losing fluid from their bloodstream into the tissues and through vomiting.
Wow, that's pretty counterintuitive.
It is. And this fluid loss can really impact the function of the kidneys and other organs.
Okay, so we've got fluid loss and electrolyte problems. What else?
Well, the increased pressure inside the intestine can also start to squeeze the blood vessels in the intestinal wall.
Oh, so it's not just blocking the flow of food, it's blocking the flow of blood, too.
Exactly. And this is where things can get really dangerous.
Because without blood flow, the tissues start to die, right?
Right. So at first, the pressure might just compress the veins and lymphatic vessels.
Which carry blood and lymph away from the tissues.
Right. But if the pressure gets bad enough, it can even cut off blood flow through the arteries and capillaries.
Which carry oxygen-rich blood to the tissues.
Exactly. And when that happens, it's called ischemia.
Ischemia, so that's lack of oxygen.
Yes. And that's when things get really serious.
Because without oxygen, the intestinal tissue can't survive.
Right. And when that happens, a bunch of other bad things can start to happen.
Like what?
Well, ischemia makes the intestinal wall more permeable, which means things can leak through it more easily.
So bacteria can leak out of the intestine into the abdominal cavity.
Exactly. And that can lead to peritonitis, which is a serious infection of the abdominal lining.
Oh, wow.
And peritonitis can lead to sepsis, which is a life-threatening condition where the infection spreads throughout the body.
So things can escalate really quickly.
They can. And then, if the blood flow is cut off for long enough, it can lead to tissue death or necrosis.
Necrosis, that's like gangrene, right?
Yeah, similar idea.
Yeah.
And necrosis can lead to perforation, which is a hole in the intestinal wall.
A hole. So all the contents of the intestine can leak out.
Exactly. And that can lead to even more serious infections.
So basically, ischemia sets off a whole cascade of terrible events.
It does. And it can also lead to problems with metabolism.
Metabolism.
Yeah, so the body starts to produce lactic acid, which can lead to metabolic acidosis.
Acidosis, that's when the blood becomes too acidic.
Right. And it can also lead to electrolyte problems like high potassium.
Which is the opposite of what we talked about earlier with low potassium.
Right. So it's kind of a double whammy.
So basically, intestinal obstruction is a really serious condition.
It is. And it's important to catch it early before all these complications develop.
Absolutely. So let's talk about warning signs. What should people be looking out for?
Well, there's some classic signs of intestinal obstruction that everyone should know.
Like what?
The most common symptom is abdominal pain, which is usually colicky at first, meaning it comes and goes in waves.
Cramping.
Yeah, like cramping.
Yeah.
But if the blood flow to the intestine is compromised, the pain can become constant and more severe.
So that's a red flag.
Definitely. And then there's vomiting, which is also very common.
Okay.
And the type of vomit can actually give clues about the location of the blockage.
How so?
Well, if the vomit is bilious, meaning it contains bile, it suggests a higher obstruction.
Because the bile hasn't had a chance to be reabsorbed.
Right. But if the vomit is fecal-like, It suggests a lower obstruction.
Oh, because the contents of the intestine are backing up all the way.
Exactly. And then there's abdominal distension, which basically means the abdomen is swollen.
Like bloating.
Yeah, bloating. And this is usually more pronounced with lower obstructions or obstructions in the large intestine.
Okay, makes sense.
And then, of course, there's constipation, which is difficulty passing stool.
And that can range from like mild constipation to complete inability to pass anything.
Right. And with a complete obstruction, people also can't pass gas.
So obstipation where nothing is coming out.
Exactly.
Okay, so those are the classic signs. What are some red flags that indicate a really serious situation?
Well, any of the signs we just talked about, if they're severe or getting worse, are definitely cause for concern.
Okay, so like really intense pain, a lot of vomiting, severe bloating.
Exactly. But there are also some specific red flags that suggest a complicated obstruction, meaning there are additional problems like ischemia or perforation.
So things that need immediate attention.
Absolutely. And these include severe, constant abdominal pain, signs of peritonitis.
Peritonitis, that's the infection of the abdominal lining.
Right. And signs of peritonitis include things like tenderness, rigidity, and rebound tenderness, which is pain when pressure is released from the abdomen.
Okay.
And then there are signs of systemic illness, like fever, high heart rate, low blood pressure, and confusion.
So the body is really struggling.
It is, and it means the infection is spreading.
Okay, what else?
Well, lab tests can also provide some clues. So, an elevated white blood cell count can indicate infection.
Right, the white blood cells are fighting off the infection.
Exactly. And then signs of metabolic upset, like acidosis and high potassium, are also big red flags.
Okay, so if someone is experiencing any of these red flags, they need to seek medical attention immediately.
Absolutely. These are signs of a surgical emergency.
So what are the first steps that medical professionals take when someone presents with possible intestinal obstruction?
Well, the first thing is to make sure the person is stable.
Checking their airway, breathing, circulation.
Exactly. That's always the first priority. And then they'll do a thorough medical history and physical exam to try to figure out what's going on.
Right, and they'll probably order some imaging tests.
Absolutely. Imaging is essential for confirming the diagnosis, locating the obstruction, identifying the cause, and looking for any complications.
So what kind of imaging tests are typically used?
The gold standard for stable patients is a CT scan with contrast.
That gives a really detailed picture of the intestines.
It does. And it can also show things like abscesses, tumors, and other abnormalities.
And for patients who are very unwell, an abdominal x-ray can provide some initial clues.
Exactly. It's not as detailed as a CT scan, but it can show things like dilated loops of bowel, which are a sign of obstruction.
Okay, so once the diagnosis is confirmed, what happens next?
Well, the treatment for intestinal obstruction depends on the cause and severity of the blockage.
Right.
But generally, the first step is to stabilize the patient.
Addressing the dehydration and electrolyte imbalances.
Right, so they'll start IV fluids and electrolytes.
And they might also place a nasogastric tube.
A nasogastric tube, or NG tube, is a tube that's inserted through the nose, down the esophagus, and into the stomach.
And that helps to decompress the stomach and intestines.
Exactly. It helps to relieve the pressure and prevent vomiting.
And it can also be used to suction out any fluids or gas that's built up.
Right. Okay, and then what? Well, if the obstruction is caused by something that can be easily removed, like a foreign body or a bezoar, they might try to do that endoscopically.
Endoscopically, meaning with a long, flexible tube with a camera on the end.
Exactly. But if the obstruction is caused by something more serious, like a tumor or volvulus, surgery is usually necessary.
To remove the blockage or repair the intestine?
Right.
So it sounds like intestinal obstruction can be a really complex condition.
It can. But the good news is that with prompt diagnosis and treatment, most people make a full recovery.
That's reassuring.
Yeah, definitely. But it's so important to be aware of the warning signs and seek medical attention right away if you think you might have an obstruction.
Absolutely. So to wrap up this deep dive, we've covered a lot of ground.
We have.
We've talked about the different ways the intestines can become blocked, the domino effect that happens in the body as a result, and the critical signs that indicate a serious problem.
And I think what's really interesting is how many different factors can play a role.
Right, from past surgeries to underlying medical conditions to even things like diet and lifestyle.
Exactly. So it's really a reminder to be aware of your body and any changes you experience.
And to seek medical attention if something doesn't feel right.
Absolutely.
Great advice. Well, thanks for breaking it all down for us. It's been a really informative deep dive.
My pleasure.
And listeners, we hope you found this helpful. And as you go about your day, maybe think about what you've learned today and consider what things in your own life or medical history might make you more aware of these kinds of issues. You know, not to make you worry, but just to be informed.
Right. Knowledge is power.
Exactly. All right, until next time, stay curious.